Wow. I've not done anything yet. I may as well just leave. So thanks for coming up. Thanks for being patient. We'll get started. Elliot at the back there is handing out little pieces of paper, which I can convince you now are not bad for you. They're not LSD. It's going to be okay. We might have an experiment later on to show you the relationship between genotype and what I call phenotype, your measured being, your physical self. But we'll hold that for later. So if you see one of these little pieces of paper come around, grab hold of it, hold on tight. You can go in the bin afterwards, but I'll tell you what to do with it later. So talks like this are kind of fun for me because I get to sort of reveal my soft underbelly. You'll see me jumping around and getting excited about things that I think are really cool. And I'm hoping that, you guys are self-selected, right? You've made it upstairs. You'll be with me on this. But we're going to talk a little bit about nature. And by nature, I'm talking about genes in principle. I'm a human geneticist. I've met epidemiologists. I now do population-based studies, which is why I look after the children of the 90s. But that's my bias, right? But to counter that, I'm also going to talk about measured stuff in the environment, which is very, very important. And I'm going to talk about the interplay between those two things, which is increasingly real. We see it in our data now. Then I'm going to talk about luck, chance, and what I mean by chance and how it has an impact on the way we do our science. And then the last thing, the parting message I want to give to you, which is extremely positive and it's dead important, is that Bristol really is second to none in terms of the public, participants getting involved in science. And I'll explain that in the context of Children of the 90s, but other studies that are happening in Bristol. Right? It's a very, very special place to do this type of thing and to do population-based science. So I've got one slide in this slide deck, okay? And it's one graph, and it's the nature bit, and we're going to talk about it for maybe 5 minutes, but that's all. After that, you're going to see some lovely pictures, which just means if you get bored of me, you can just sort of drift onto looking at pictures of balloons and stuff instead. So that hopefully carry through you what's only going to be 20 minutes anyway. Right, but to that one graph. Okay, so how do I advance these? There we go. This is the one graph. Now, I'm going to contextualize nature in terms of the relative contribution of genetics to stuff. Height, weight, disease, and so on, and things like that. But what I want to do is tell a story of the shape of those effects, because I think genes get a bad press. I think often when we think about genetics and the nature bit, we think crumbs, families, determinism, inescapable effects, major problems, congenital changes, things like that. Not necessarily the case. And this is a landscape of genetic effects. The reason I'm so excited about it is this represents the culmination of genetics research over literally decades. We can now tell the story of this landscape in full because with the studies, the human studies that are interested in genetics at a population level have come on so far and are now so big. So let's walk through this landscape together. And start in the top left-hand corner here with these things. And I want to give you the full context of the graph, so I will explain the lines first. On the bottom here, you've got a line that just goes from low to high, pointer, from low to high in terms of the frequency of the change. How often this thing is observed in the population. I'm talking about mutations in the population, changes in the code that you may carry and you may not. Right? How often do those events occur? A bit like saying, how many smokers are there roughly? We now know roughly 15% of people are smoking, the rest aren't. That's the frequency of that event. So I'm just communicating that in terms of the nature component, the genetics, right? Up on this part of the graph, it's the gravity of their effect. Whether they don't really do anything to your manifest self or whether they change you completely. Now, into that landscape, we're going to work through and look at different types of genetic effect. So I said we'd start with these ones up here, and I put a family tree up there. Now, we can measure very rare changes, the sort of thing a physician or a clinician might see in a family occurring because it's a big change, right? It occurs very rarely. It essentially escapes natural selection because it's brand new. It has not been selected yet. It's not been removed from the general population yet. And it appears to track in families. Granny had it, and it goes down to cousin, and cousin had it, it goes down to so on. Those patterns of heritability are well charted, and they happen for de novo, brand new mutations, and they can be very strong effects because they slip underneath the radar of selection. They've not existed for a long time. Moving down, I should say that those are quite easy to see. You see them tracking in families, and they do really radical things to people. If you were trying to find the same sort of frequency of event, but it did nothing at all, well, it's very, very hard to find, right? No doctor ever sees them. We can't ever measure them. You just don't get them in research, okay? Counter those types of effect which have large impact on health with things at the other end. So they're high in frequency, they're old, they've been knocking around in the population for a long time, but selection has been weeding out the ones that really change our health. Because it would be impossible to have a lineage of people that carried a radical health effect through millennia and lots of familial generations. So they're up here in terms of frequency, but right down the bottom in terms of effect, which is where we've been doing lots of work trying to get big population studies to mine those types of effects. They have a natural antithesis as well, of course, which would be high frequency, high effect. Well, those guys are gone, right? As nice as it would be to maintain them, and maybe there's a few knocking around for positive things, how fast you could run maybe or something like that, but they're certainly not there for detrimental things. Now that landscape, rare to frequent, low to big effects, we can now see in our data. We see the rare familial effects, we see the less frequent population-based effects. And why is that important? It's important because the complexity of the health measure that we're interested in has an effect on, or at least is related to, the type of genetic effects that we see. Now, there are rare, inescapable, deterministic effects which families are blighted with and were awful. And things like 100,000 Genomes UK, a big government initiative to do genetics, is trying to help. But that does not preclude the existence of small, frequent changes that happen in us all. Right? Genetics is not a scary thing. It is absolutely prerequisite to your physical being alongside the environment. If somebody measures your blood pressure, they're not just doing an environmental measure. They are literally taking the temperature of the genetics and the environment working together. Now, that type of complex measurement, which involves the pump, the liquid, the veins, everything we're measuring by one number, by sticking a pump on your arm, means that actually it's a composite of lots and lots and lots of little things, and by and large, resides down here. It is still heritable, it's still genetic, but just not the same flavor as those rare, really pokey, nasty events that happen we see very, very infrequently in families. So it's not that genetics is one thing or another, it's pervasive. It sits right across the patch, but it's in different flavors, and that's really, really important. Right? Understanding it helps us understand biology. It does not mean that it's super scary and is deterministically going to kill us all. And that's a very, very important distinction, a sort of enlightening feeling about genetics, which is very important. Okay, so that's the only graph today, but it moves me naturally on to the nurture bit. Right? So counter the nature with the nurture. What is it about the environment that's kind of interesting? Now, I'm naturally interested in the environment. I spent most of my career looking at cardiometabolic disease, so type 2 diabetes and adiposity and things like that. And we know if you take type 2 diabetes, you can pretty much treat diabetes by changing the environment. If people get their diet right and they get their activity right, they can usually control their blood glucose and off you go. That's great. However, what's really important to bear in mind is that there is still a heritable component to that. It's just down here, isn't it? It's not a rare familial thing. It's a different flavor of genetic effect. And what's, I think, super interesting is that as our population-based studies have got bigger and bigger and bigger, we now do studies with literally hundreds of thousands of people in them, our ability to see really little things has got better and better and better. And this has generated a car crash between nature and nurture. We now see, in fact, I've been challenging my team to try and find genuine environmental things which aren't secretly heritable as well. Where you live, your education, your choice of voting, these things are all a little bit heritable. They sit on a continuum of genetic contribution. Some of it is a lot of genes and not a lot of environmental stuff, pure environment, and some of it is the opposite. But actually, some of these complex behaviors are now crossing over. We thought there was environment. We tried to get rid of them by measuring them and chucking them out of our studies. But they're heritable too. We've just done this beautiful study in the children of the 90s where we've looked at how people's family history, so this is all people in Bristol, but where their families come from in the UK. And you can take their DNA and you can say, well, look, your lineage comes from Scotland and your lineage originally comes from Wales and so on and so forth. Those patterns, you lie them over the UK and you can see where families are migrating. You can see how it's related to their health and their demographics, right? Educational attainment, opportunities, the way in which you interact with your environment has a little bit of genetics in there too, and if you've got a big enough study, you can see it. So what I'm trying to dispel is the notion that there is a hard line, nature-nurture thing going on. Sure, there is a relative contribution of those two things, But actually, the truth is that it's a lot muddier than that. And that's a really interesting concept. Alongside that then sits chance and luck. So we've got genetics which feeds into health, and we told a story about type 2 diabetes that feeds into health. But actually, there is a chance element, and I'll let you into a secret. So I'm an epidemiologist these days, so I study things that affect people. That's how I'm interested in disease, particularly. As epidemiologists, what we are very talented at doing, is we have great big studies now, is saying that the on-average flavor of people and risk looks a bit like this. So if you see 1,000 versions of you, then I can say that actually, on average, your type of person responds to a challenge or a disease in this way. It's not you, though. As epidemiologists, we are pretty bad, actually, at telling the stories of individuals. And this is where the chance thing comes in. What do I mean by chance? I mean how likely things agree with randomness. My first-hand experience of randomness, trying to guess the sex of my child using that ring on a string thing. Did it once, it's going to be a boy. Do it twice, it's going to be a girl. Do it 50 times, which we did in the living room. 50-50, bang on. Right? It's chance. It's stochastic. It's just variation in the real world, right? And that's a really important concept because it plays into this. It's the challenge of the clinical world. You've got somebody in front of you who's poorly, you know the risk factors for a disease, you think you know how much genetics is going on with it, but actually Joe Bloggs doesn't respond to that drug in that way because they're idiosyncratic. They're different, they're personal. They have their own environment, which is completely random. Okay, there's a paper at the back of the room which you can take on your way out if you're interested. It's a really nice paper, it's beautifully written, but it's got a classic anecdote of this in it. Lady called Winnie who gets to 100 years old and she's been smoking every day of her life. No, I tell a lie, she's been smoking for 93 years. And the headline in The Sun is, Winnie, 100 years old, 93 years smoking and ain't gonna give up yet. Right? Now, fine. So there's two ways of painting that picture, right? So Winnie could just be super healthy and it's not chance at all. There's something about her which is hardwired, which means she resists that awful insult. Okay, the other thing is the story that actually the day that she got her neoplasia in her lung, which was going to kill her ultimately, she walked out the front door and a breath of cold air made her cough and splutter and she spat it out. That's chance. It's complete chance, and I can't measure that, right? I can't see that as an epidemiologist. Doesn't mean that what I do is bad, because I want to tell the story of everybody. And on average, it's good to say, do these things, don't do these things, treat you in that way, don't treat you in that way. It's how we operate. It's the best evidence that we've got. But chance is very important, and it will determine the outcome of you as individuals, rather than a total population. Okay, so that's nature, that's nurture, and I've touched on chance. The next bit about it is measurement. Okay, so there have been lots of quotes over the years from famous wealth physicists and all sorts of people saying, if you can't measure it, if you can't turn it into numbers, we don't know anything about it. Okay, and I kind of agree with that. Measurement is the key to trying to advance our knowledge about the interplay between nature and nurture. If I can't measure events and see on average effects and tell the stories of whether it's just chance or otherwise, I can't improve it, I can't intervene, I can't do something about it or make a policy. And that's very, very important. So, and this is where I turn to what's happening in Bristol. So children of the 90s, 14,000 mums in 1990, 1991, 75% of all the pregnancies in that period, recruited, followed up through time, still going strong. Extraordinary study because it measures so much about people's lives on such an appropriate scale. Those types of studies, in fact in Bristol we're blessed because we also have UK Biobank taking participants into the study as well. We now know that we've got more than 1,000 people in both studies, and we can link the two together. I mean, we've got this hub of fantastic science in Bristol and people being involved in science. And without having participants involved in science, there is no material to work on. There's no way of testing the nurture versus the nurture. Okay? There's no way of thinking about interventions or policies that do something and change people's lives. So being involved in those studies allows people like me and the researchers who operate on the data, I should say that something like Children of the 90s, several thousand publications in the last 4 years, 800 researchers internationally on the books using the data and the sample. It's radical scale of contribution from a study that's based in Bristol and that I don't control at all, the participants control, right, with their interaction with the study. So that's super important. I can't impress upon you more how important that is. Provision of material, allowing measurement, getting involved. Now we've got, I don't know, did anybody get the papers that came round, those little things? Most people? Right, so I'll give you an acid test of how important measurement is. So if you're brave enough, put it on your tongue now. It's not psychedelic, don't worry. You're going to survive. Get it moist, back of your tongue or right in the middle. You can shut your mouth, doesn't matter, just don't swallow it. If you swallow it, it won't kill you anyway. Now then, just let it get moist for a while and I'll tell you the story of what it is. So one of the classic clinal phenotypes in humans, by clinal I mean it varies in frequency by geography, is taste. On that piece of paper is a chemical, which is the ligand for a very specific receptor on your tongue. Okay, now some people carry a genetic change, which means that they can't taste it. I can't taste it, it's just like a bit of blotting paper to me. Other people think it's horrible, right? So just, if you've been brave enough, how many horribles and how many, right? So the majority horribles, right? So in the UK, right, it's about 60-30 split, horrible to not horrible, okay? Which is what we're seeing in the room in real time. Now, the reason that that experiment works in real time in this tiny little collection of people is because I've just performed the perfect measurement. The ligand, the gunk that stimulates a specific receptor on your tongue. Compare that to a study that I might do in the general population based on questionnaires. When I ask you how you feel about it, maybe, if you remember doing it 2 weeks ago. That generates noise. It makes a poor measurement. It means I need big samples. Again, why is children's so important? Because it's a big sample that runs through time and it gives me precision in the absence of the perfect measure that we've just used. Okay, so involvement in people getting involved in science, helping us out, and believing in the study and its security and its governance and all of that is absolutely critical. Okay, so what we've done is we've talked about hardwired contributions, but I want you to believe that those hardwired contributions vary, right? They're not all deterministic. They're not all familial, congenital effects that are going to change you forever. Some of them are actually rather soft effects, and they sit in a complex contribution to what you actually are. The classic example, human height, adult attained height. We now do studies. The studies have hit 1 million people in the genetic contributions to attained height. The biggest single effect of all of those studies, common genetic changes on a complex thing like height, is smaller than the diurnal range in height. That's the difference in your height from when you go to bed to when you wake up in the morning. Tiny, irrelevant effect, but actually tells a story of the collection of events that make realized human height. If you think about it, it makes a lot of sense. Pretty much everything in your physical being contributes to your height in one way or another, and we see that borne out. So there are different flavors of nature, and that's a really important message to take away. Nurture, don't throw it away, it's clearly important. We can use nurture to help us because we can use drugs and change people's diets and ask them to walk around more, and we can tweak it. What's fascinating to me is as our studies get bigger and bigger, there's less pure nurture out there than I used to think there was. And actually a lot of the behaviors and stuff that we thought was the environment is actually heritable too. We then talked about chance, and that's important because that gives you the personal view in that grand context of genetic and environmental contributions. And an understanding that actually, a good example of chance, really, as horrible as it is the inevitability of cancer, right? So it's totally remarkable that we don't get it all earlier. Your cells are turning over every single day, rapidly, skin's turning over, regeneration of cells. That's all bridled and controlled. Mistakes in that control lead to radical cell growth. We call it cancer. It takes many forms. But it's amazing to think that we can control that as a biological system. So actually, the chance events, if you perturb those systems, whether you do smoke, whether you don't smoke, what happened to you in childhood, what your environment's throwing at you as a result of your work, and so on, it's going to upset that balance. So you're changing those chances by your personal ride, which is difficult for me as an epidemiologist to predict. So chance is really important whether we like it or otherwise. And then lastly, then just to finish and just to really drive home, all of that is predicated, or at least our knowledge of it, is predicated by measurement and having information available to us. And, you know, Sidney Breda said it, who's an absolutely fabulous Nobel laureate who's passed away since, but humans are the right test model. You know, you can do work in cells, you can do work in animals. None of it comes close to understanding how people actually work. And large-scale population studies, the biobanks, the children of the 90s of the world, make a huge difference to that portfolio. So with that, I think I'll close, and I'm very happy to take any questions about what I've talked about.